Hello, I'm Dr. Tony Urbina, professor of medicine at the Icahn School of Medicine here in New York City, and I'm the medical director of the HIV and Primary Care Center of Excellence of the New York State Department of Health AIDS Institute. And today I'm going to talk a little bit more about implementation of long-acting injectables. Previously, I spoke about the approval of the long-acting injectable Cabenuva. So now I'm going to drill down into what are going to be some of the issues in terms of implementing this new therapy. So one of the challenges besides getting authorization for patients for these long-acting injectables is how are the insurances going to pay for it? Is it going to go through a pharmacy benefit plan? Or is it going to go through a specialty pharmacy? Or is it going to be acquired through a medical benefit via a hospital? So those issues are going to have to be sorted out because that's going to determine how this medication is going to be shipped and, importantly, how it's going to be stored. So one of the important aspects of Cabenuva is that it needs to be refrigerated. And the way that it has to be refrigerated is it has to be refrigerated in this box. And this is how it's going to come. So this box is not small. So you're going to have to factor in to your flow adequate refrigeration space. Once the medication is shipped and stored, then you're going to have to work on a process and flow to get the drug to the patient. The medications need to be put out to room temperature for at least 15 minutes before they can be injected. And once it's opened, you can only have up to 6 hours to administer the medication. So your timing has to be spot on. Another part of the process and flow is who is going to give the injection. I think at Sinai, what we're going to try to do is have our nurses keep track of the injection. So not only are they going to schedule the patients, they're going to have a process to make sure that they come in, that they receive the injection, that they're monitored after the injection, and that then subsequent appointments are made so that they don't miss the windows. And this is going to take a lot of choreography, and I think our clinic flow is going to utilize our electronic medical record to really act as reminders for both staff and patients about when their next dose is due. So again, a little bit of choreography, but I think it's a very exciting time for our patients. Novel therapeutics, novel ways of delivering these drugs. And again, I think it's going to have a great impact on our patients.